Oke, Assalamualaikum warahmatullahi wabarakatuh. My name is Nimaja Ayunila Septianingrum. I'm from Faculty of Health Science, major of Pharmacy. Here I will represent about review of pharmaceutical service at community pharmacies for people with disabilities. The background. The background of the research, one of which is taken from WHO or WHO, data which show that the number of persons with disabilities in the world in 2010 was 15.6% of the total world population, or more than 1 billion. The result of the 2018 basic health research or research does show that the prevalence of disability in the Indonesian population aged 5 until 17 years is 3.3%. And the 18 until 59-year age group is reached until 22%. Persons with disability said that people with disability have the same rate as normal people in general, especially in public services. For example, in health service, there are not many public facilities that provide special room for people with disabilities. In pharmacies, there are still many that don't provide road access for people with disabilities who use wheelchairs. Or there are still many employees who serve patients who are not able to communicate well with the patient. And the method this review was conducted to identify this study. The study was limited in English and publication from 2016 until 2020, and the electronic database used to identify relevant studies, PubMed, ScienceDirect, PubQuest, and Sagipop. The characteristics and result of the study were recorded and compared. The keyword used are Boolean. Maybe we use and or combination both of them. The initial of the journal obtained was 3583 journals, then selected according to the desired inclusion, namely pharmaceutical care and disability, so that as many as 77 journals were obtained. Of the 77 journals, they were summarized uh, again based on the research criteria used, so that 5 main journals were used in this systematic review. And then the result, according to government regulation number 55 of the 29 years, pharmaceutical services are direct and responsible services service to patient relate to pharmaceutical preparation with the aim of saving defined result to improve the patient quality of life. For a health professional must be able to apply the best practice of himself in order to be aware of the communication skill of each patient. If the provider cannot effectively convey important information to the patient, the expected treatment goals will not be achieved. Research conducted in Addis Ababa, Ethiopia, said that out of 19 respondents, 15 of them said that they couldn't access a community pharmacy service in their area. 12 of them said that the obstacle came from transportation barriers. And the conclusion from this review is the problem of the pharmaceutical service, but in terms of the community, especially with health workers or pharmaceutical personnel in several countries, is almost the same. These activities are not only hampered in terms of physical and communication, but also in terms of human resource. There need to be special training and regulation that regulate pharmaceutical services to certain groups, so that all lines feel that they receive the same treatment in health. Access to health for persons with disabilities need to be improved. especially in public facilities, so that they can also be independent in carrying out an activity. Thank you.